So COVID vaccines for kids under the age of 12 could be just 1 to 2 weeks away in Canada. And there have been some other developments on the vaccine front as well. So we thought it was a good time to bring in a couple of experts. Here tonight is virologist and Canada Research Chair at the University of Manitoba, Jason Kindrachuk. He is in Winnipeg. And pediatric infectious diseases specialist, Dr. Fatima Kakar, and she is in Montreal. Hi to both of you.
Hello.
Good evening.
Dr. Kakar, based on what you're hearing, who you're talking to, do you think kids will be able to get vaccinated, that it will be available to children in Canada before Christmas?
It will. It will be tight. So first, we're still waiting for Health Canada approval, but I know the different provincial committees and NACIs are working really hard behind the scenes to be ready as soon as they have word from Health Canada. And so as soon as they'll put out their recommendations and the rollout plan will happen. So we have a few weeks. It'll be tight, but I think we'll have first shots in arms by Christmas.
In your practice, you're talking to children and presumably their parents all the time, Dr. Kakar. What is your sense of how parents are going to react when these vaccines are approved for children?
So there's one group that's ready to go. They're asking me how soon, how, where, what. And so they're going to sign up as soon as those slots open. Now, there's another group that's asking me, do I need this vaccine? Should I take this vaccine? And that's the group that we're being really proactive right now and telling them about the vaccine, and we'll have to have more time with that. But I would say there's about 50% of people that are ready to go out there and get the vaccine as soon as we have it there.
I'm going to bring Jason into this conversation in a moment, but Dr. Kakar, I do want to ask you one other thing about that. Have you thought about what your approach is going to be for those hesitant parents?
Sure, and I think it's really important. So because it's very different in kids than it is in adults, I'm not forcing anyone to make a decision imminently. So there's going to be many opportunities to get the vaccine, and we're going to have many opportunities to talk to parents who may be hesitant. So, for those who are ready to go, the vaccine will be there. But for those who might be hesitant and have questions, we're all gearing up to be ready to answer those questions.
All right, let's change the topic for a moment. Professor Kindrachuk, as you know, the Johnson & Johnson vaccine is coming to at least parts of Canada. In British Columbia, they've announced that unvaccinated healthcare workers will be given priority when it does arrive in the province next week. Alberta has announced that it's received 5,000 doses. Saskatchewan is expecting some to arrive. What should we know about what the Johnson & Johnson Janssen vaccine has to offer?
It's a great question, right? We've heard a lot about Johnson & Johnson because this was touted as going to be basically a single-dose vaccine. I think some of the more recent data from the U.S. has suggested that certainly a booster dose is being recommended for those that have gotten that original single dose, but it does provide protection. And I think that's the important thing when we think about this idea of moving into communities where maybe there has been a reluctance or a hesitance based on the mRNA technology and based on this idea that we keep hearing about of potentially waning immunity and some of that kind of discussion. I think being able to have another option for people is very, very important. We have to, though, appreciate that there are caveats that come with this vaccine. It has not certainly, I think, lived up to the expectations of what we've seen with the mRNA vaccines, but then again, not a lot has been able to. So I think being able to have something else in our arsenal is very, very important. If we're able to move, that barometer in regards to uptake by even a couple of percentage points, that's very, very important considering where we stand right now with Delta.
What's interesting, Professor Kindrachuk, is Dr. Bonnie Henry, the Chief Public Health Officer here in British Columbia, said she's received a lot of inquiries from unvaccinated healthcare workers who want the Johnson & Johnson vaccine, who are, I guess, they're reluctant to take the mRNA vaccine. And so you're a virologist. Is there any science behind that, why the mRNA would be less useful or less safe than the Johnson & Johnson vaccine?
It's a good question. I think that, with the mRNA vaccine, certainly there has maybe been this narrative that's been created that these are brand new vaccines and that they haven't been tested prior to COVID. And certainly if you go back through the literature, you look at prior, studies and investigations that have used the mRNA platform, there are years of data that have gone into this and certainly prior clinical trial data that has given us a good safety profile of the vaccines. But there is that uncomfortability, I think, for a lot of people in that this is a new platform. So those questions of what are the long-term effects, how does the vaccine work, what is mRNA, those things I think are still circulating. And of course, social media and misinformation have played into that. So I can understand the hesitancy. I think we need to be quite frank with people about what the benefits are of the different vaccines. But ultimately, if we can get more people vaccinated, that's really the critical juncture that we sit at.
But I guess we can say this, but I'll ask you, Professor Kindrachuk, as far as you're concerned, all of those vaccines are what? Being basically safe for Canadians to use?
Yeah, I think right now, when you look at the safety profiles, they are, right? I mean, certainly the mRNA vaccines, we've seen billions of doses so far. Even when we look at AstraZeneca and Johnson & Johnson, we've seen a lot of data that has come out of population-level data, not just clinical trial data. So the vaccines continue to show that the risk versus benefit ratio is so far towards the benefit that I think we need to tout the fact that the vaccines are very, very safe, and they do have good effectiveness against symptomatic disease.
I have time for maybe about 30 seconds from each of you on this. You're in different parts of the country, a different perspective perhaps on where we're at in terms of this pandemic and what the next 6 weeks or so will look like as we get into the holiday season. Dr. Kakar, let me start with you. What's the perspective from Quebec?
So we are a little bit worried getting into the winter season, everybody indoors, as well as holiday season altogether. So it's really important that everybody who isn't vaccinated be vaccinated. And we're hoping that when we have more kids vaccinated, the holiday surge is not going to be as bad as we anticipate. But we are a little anxious looking at what's happening in Europe right now with the surge there in anticipation of a potential fifth wave.
And Professor Kindrachuk, we know Manitoba is a hot spot. What's your view of what the next 6 weeks might look like?
We're concerned. Right now we have to figure out a way to get transmission across the province reduced and back to those kind of post-third wave level. I think we're struggling a little bit, certainly with vaccine uptake in certain regions of the province, but we have to appreciate now the virus has moved more broadly. So we have to preserve our healthcare system, and we have to figure out a mechanism to be able to get the virus to stop in its tracks as well as we can over the next few weeks.
Well, as always, really nice having your perspectives. Thanks for giving us some of your Sunday evening.
Thank
you, Ian.